Audiology Associates in Hearing Aids Today started 12 years ago. We've just really enjoyed the opportunity to be involved in our community and help people and make a difference in their lives. Some of the common signs and symptoms that we see with hearing loss, one of the biggest ones I hear is, I can hear, but I don't understand. As well, when people report they have trouble hearing in noise, that can be a sign of hearing loss. Having to turn the TV up loudly. Really important things. So if you're starting to notice that people mumble, asking people to repeat, not understanding clearly, definitely come in and get it tested. It's a good place to start to at least learn what's going on. The first thing we're going to do is actually sit down and talk with you and get to know you. We're going to talk about your medical history, then we're going to talk about your hearing history and kind of tease out where you're really struggling and having issues. And during all this, I'm actually doing what's called a lifestyle assessment. We're going to try to figure out what your needs are on a daily basis because every person is different. After we get done collecting some of that information, then we're going to put you in the booth. And you're going to do the basics where when you hear the beep, raise your hand. And one of the special tests that we do is called the Quick Speech and Noise Test. This test is where you will actually repeat sentences. And there's noise that's present and it gets progressively harder as we go through the testing. This lets us see if you have a true handicap with noise, which then helps us to pick the products that are going to give you the best chance of succeeding in more challenging environments like a restaurant or when the whole family's over. After we've done the testing, we will sit down then and talk about treatment options, depending on what you need. Our biggest thought here is, we will manage your hearing loss, you manage your budget. You know what your budget is, and we have a great variety of products that will fit virtually any type of hearing loss out there. So it's just a matter of figuring out what we need to do that's best for you. When patients come in, oftentimes they're very nervous about having their hearing tested. And what I try to reassure them is, first of all, hearing testing is painless. It will not hurt you. We will explain everything step by step, and I think the fear really comes in not knowing. So if we can educate you and teach you what's going on with your hearing, it's always your choice what you decide to do. But we want to give you those tools to make good decisions and to break it down in terms that you understand. We want you to know when you leave here how you hear, how your hearing system works, and if you need help, what some great options might be.